Good afternoon, everybody. I'm very glad to see you all, and especially Maria and Carlos, of course. We are very good collaborators in a lot of projects, and we had the opportunity today to show you some of the projects that we're running with the Biomedical Engineering Laboratory of the National Technical University of Athens. I'm George Matsopoulos. I'm a professor at the university, and I'm the director of the lab. So most of our presentations are covering, I think, 6 projects we're running with our partners, all of them involved on the biomedical engineering. One of them is the TeleRehaB DSS. Just some information about this project. It was under an Horizon call, as you can see here, and we ended up successfully to start up the project on 2022. It's a project of duration of 36 months with a total cost just above 5 million euros. Again, the Biomedical Engineering Laboratory of the Institute of Communication and Computer Systems at the National Technical University of Athens is the coordinator of the projects. As you can see here, it's a project that runs all over Europe, involving 15 partners from 10 different countries, and including 5 of them are the clinicians ones, and they are involved in the clinical study and the implementation and validation of the platform that is going to be developed throughout the project. Here, just some information, except ICCS, which is the coordinator. We have clinical partners coming from Thailand, Portugal, Germany, and Greece. We have technical partners from Serbia, Estonia, Portugal, and Greece. And of course, we have partners while dealing with ethics, exploitation, and dissemination. The main idea of the project comes from the fact that falls account from 58% on emergency units in individuals that are over 65 years old. And if we have to deal with some costs, that means that study says if you continue the same situation up to the 2050, we have a cost of 45 million euros for this kind of fall subjects. Of course, there is not only falling due to the anatomical, mechanical reasons, but of course there are a lot of other side effects or other diseases or problems like the cardiovascular or cognitive disorders that many of these people are facing, which are increasing the risk for the falls. Also, we have to say that there is no specific units, specific centers to provide specific services for these people. So one of the objectives of the project is to develop this platform to cover this limitation of specializing services. And also it is a poor patient adherence and technology adaptation, since 70% of the patients drop out early from existing exercise programs. This means that we have high cost, we have adaptation, and take adaptation challenges. Finally, we have to revise a bit the work among all the clinical and technical partners in order to tailor some programs and to focus on these problems and to the specific needs of high-risk individuals. So that's why the TeleRehaB DSS comes, which is as a general idea of the projects is to integrate artificial intelligence tools into balanced rehabilitation in order to enhance clinical decision making, optimizing patient care, and improving treatment outcomes. The idea of TeleRehaB DSS comes from another project which was previously finished and where we participated on that, called the HoloBalance AR platform, where throughout this program the HoloBalance platform was developed for monitoring patients with balance disorders, and is an extension basically of the HoloBalance platform by using novel techniques like artificial intelligence for the same scope. So what are the objectives of the project? The objective is to develop and implement artificial intelligence models to assist fall risk treatment effectiveness and patient outcomes. Is the personalized rehabilitation plans for each patient based on a clinical and socioeconomic factors. Is to introduce a real-time remote patient monitoring system through wearables and IoT devices. Provide virtual feedback and motivation via AR for home-based rehabilitation, and finally ensure that patients' adherence by evaluating e-health literacy and technological awareness are there. You will see that this involves not only people that falls, but specific 4 categories that are related to these falls, either stroke, either mild cognitive impairment, long COVID-19, as well as vestibular dislocation. The platform consists of 4 modules, if I can say. The first one is the expert dashboard, where all the scheduling activities, patient's performance, reported treatment interventions are included. We have a mobile app for the patient where we are triggering the patient to self-manage questionnaires to communicate so we can have easy access to the data and to feedback. We have the cloud decision support system for the prediction of risk of falls, either for side effects and also the treatment outcome. And this gives an idea and focusing on personalized interventions and management of the patients. Finally, the platform consists of what we call it virtual coaching platform, where the artificial intelligence-based treatment monitoring system will real-time evaluate and give feedback to the any training activity that the patient is doing. Okay, the validation study of the TeleRehaB DSS will consist of 4 basically different aspects of causing falls, as I explained before, which is the stroke, the MCI, the vestibular dislocation, and the long COVID-19. We have involved in these validation studies have 5 clinical different sites for the evaluation of the platform, starting from the UK, going to Greece, Germany, Thailand, and Portugal. We're going to involve around 460 participations, where half of them are control and intervention group, and we have constructing the study. So we have 4 rounds of 4 to 12 weeks intervention that goes to up to the 12 months for 5 days per week. Where we are at the moment, as I explained to you, the platform has already finished completely in terms of design and the specification of the expert dashboards, also the mobile ad and the cloud infrastructure. Actually, we have the first version of the TeleRehaB DSS platform, which was released. And last week we have the clinical meeting in Athens, where I presented this platform to the clinicians in order the trials to be start as soon as possible. Outcomes of the project is, of course, we integrate artificial intelligence models as in all of the projects. That's the motive from EU at the moment, using new technologies. So, we are focusing on the specific problem, and we parallel cooperate augmented reality tools used even in the HoloBalance, but we actually develop a new augmented reality tool for remote sensing monitoring. We are focusing on the personalized treatment. This can be done by using real-time sensors and taking the data and the patient's profiles to tailor the psychotherapy and cognitive treatment exercise. We reduce healthcare visits. We hope, of course, to minimize the number of the necessary appointments for the patients to the clinics. Also, we think that will decrease the fall incidence and comorbidities, as I explained before, by trying to force the patients by using all these tools for a healthier environment with exercise and doing a lot of other interventions. And of course, that means that improve the quality of life for the patients generally. Of course, we are aligned as in all of the projects with the motive of the EU structure. In this case, we optimize throughout the project the EU healthcare systems by providing this platform. We integrate new technologies as artificial intelligence and also augmenting reality techniques. We hope that we minimize or reduce the amount of money spent for the patients that falls with this kind of by 10% by using this platform. Of course, we have the benefits, other benefits like reduce anxiety and boost compliance with the treatment of the patients. And of course, we'll develop generally an e-health tool to evaluate technology literacy and predict patients' compliance. So to sum up, we are aiming to use another advanced tool for the people that need, especially the people that fall down. We implement key technologies like artificial intelligence, augmented reality, and of course all of them we use a user-centric design. We aiming at the end of the day to deliver personalized care, more effective rehabilitation of the patients, and of course enhance the access to the treatment throughout the platform. And of course the ultimate goal of all that is to improve the quality of life for this kind of patients. Thanks very much.
Thank you, George.